Hello and welcome to the latest episode of the Alkem Health and Wellness podcast, a collaboration between Woman This Month and Alkem Health and Wellness Centre. So today I'm joined by Dr. Taal, a naturopathic functional doctor. Thank you very much for joining us on the podcast.
Thanks for having me. Happy to be here.
Firstly, can you actually tell us exactly what a naturopathic functional doctor sort of is and what sort of areas you cover, and before we move on to actually discussing how that links to the menopause?
A functional naturopathic doctor looks at the entirety of a patient. We want to understand all aspects of their health and background so that we can try to piece together the symptoms that they're experiencing and then identify the root cause or the main reason why they're feeling the way that they're feeling. A lot of Western medicine tends to focus on symptomatic relief, which can be extremely helpful and is necessary, absolutely. But I think what it misses is going deeper and trying to figure out the cause. Because as I said before, when you treat that, not only do you bring symptom relief, but you actually bring healing on a different level to hopefully prevent that person from getting ill or having those symptoms again.
To start off, can you tell our viewers and listeners exactly the differences between what we traditionally call the menopause and the perimenopause?
Perimenopause is the length of time, anywhere from 2 to 10 years, where a woman's menstrual cycle becomes increasingly irregular. And menopause is actually a single point in time. It is after a full calendar year has passed. If she has had no menstruation or menstrual activity in that full 12 months, as soon as that 12-month clock crosses, she is into post-menopause at that point.
So when a woman comes to you and says, I think I'm in the menopause, what's sort of your first reaction, or what do you want to hear from her first?
One of the first things that I want to find out are what she is experiencing and how that might be impacting her daily life. If a woman is experiencing symptoms and they are actually disrupting her day-to-day and or causing her to question her state of health, some cases peace of mind, I think that's when you should start to inquire of your healthcare practitioners to try and understand whether or not your hormones are potentially contributing to that. I think at that point, appropriate diagnosis is super important, and testing is key to that, because once you identify and correlate those symptoms and those hormone levels, it then provides a fairly good roadmap to try and correct those imbalances, and then by doing so, bring relief of those symptoms.
How is hormone therapy in general changing the conversation around the menopause?
I think that a lot of our current understanding of hormone therapy really still stems from a study called the Women's Health Initiative that took place in around the early 2000s. And while there were some strengths associated with the study, there was like 16,000, I think, women enrolled in the hormone replacement therapy arm. It ran into some problems because, and actually had to be stopped because of the health challenges that the participants were encountering, specifically with regards to like stroke, heart attack, cancer. I think it's important to understand that since then, there have been significant changes, not only to the interventions that we use, but also in how we use them. And so one of the key challenges that they faced with that study was that the average age of women participating was 65. And in some cases, that was 5, if not 10 years past the point where that woman would have entered into menopause. And so, yes, while I do encounter misinformation in a lot of cases, and more often than not, just a lack of general awareness, I feel like in general, the patients that I see are really open to having a conversation because they really just need support and symptom relief. And so I do a lot of education in the treatments and the protocols and the patient relationship, because it's important for me that they understand not only what we're trying to do, but why and how it works.
So what should women know about bioidentical options, safety, and personalization?
When you compare a synthetic hormone versus a bioidentical hormone replacement therapy option, the structure is completely different. The synthetic options are distinctly different from the hormones that your body naturally produces. And you can see it in the chemical structure. As a result of that difference, a lot of the side effects can be attributed. Now, when you look at the bioidentical or body identical hormone replacement therapy, they are identical in structure to what your body naturally produces. And then as a result of that, the uptake is better, the side effect profiles are less, and I think patients see more benefit than net risk if you were to compare them.
So how do things like metabolism, mood, all those levers sort of connect with each other?
As women's hormones change over time, what happens through perimenopause into menopause is that the levels drop consistently. Now, whereas testosterone, progesterone tend to drop more consistently, estrogen tends to be more erratic. As a result of that, you can end up with extreme differences between the three main hormones. And what's important to understand is that all of our hormones need to function in relative balance to each other. Now, something like estrogen is actually neuroprotective. It supports brain function. And as estrogen levels drop, it can impact the brain's ability to function well. And on the flip side of things, progesterone, counterbalance to estrogen, is more neurocalming. So whereas estrogen tends to be the hot, moving, active hormone, progesterone is the coolant of that, and you need both. And so in those situations where estrogen levels increase beyond the balancing effect of progesterone, you can see things like increased anxiety, as an example. When we bring those symptoms back into balance, you can actually see a significant improvement in those areas. Now, the metabolic aspect that we're talking about in terms of the weight gain that is really, really common has a lot to do with the insulin resistance that develops as estrogen and testosterone levels drop. Our body's ability to metabolize sugars just decreases significantly. When that happens, we see impacts against cognition, again, because the brain requires a lot of sugar and needs to be able to metabolize sugars in order to function. And so when we start to see increased insulin resistance, it can affect that.
Now we'll talk about the smart hormone testing. Can you, well, firstly, just explain what that is in a nutshell, please?
Sure, yeah. So smart testing really is knowing what tests to run to get the most impact with the least invasiveness that will have a significant impact on how we choose to treat. And I tend to do this in stages, using blood tests as sort of the anchoring tests that we do. And then depending on the nature of the patient and the concern, using things, more functional tests that may measure salivary levels versus urine metabolites, just to kind of get a more comprehensive view.
These tests, are they, as you say, blood, urine, are they very wide encompassing like that? Sort of what does a average sort of test look like?
A complete metabolic panel covers generally the main functions that go on in terms of blood sugar, inflammation, things like cholesterol, liver, kidney health, et cetera, which if you haven't done in the course of a year is immensely important. Beyond that, the hormones themselves are vital when we're trying to understand the impact that they're having. And understanding when to test within a woman's monthly cycle is crucial, because it really only makes sense to test at 2 or 3 specific times, depending on what we're trying to do. And this is, I should clarify, for people who are cycling regularly, because we need to benchmark it against specific times within the cycle. So for a menstruating woman who is regularly menstruating, it's specifically targeted. It'll either be day 2 or day 3 after a woman's menstruation starts, and or 7 days plus or minus 1 from ovulation. If we're already into perimenopause and menopause where there's no cycle per se, then it's a little more flexible as to when we test. But knowing when and what tests to do is really important.
How often, say, in a year, would you suggest checking? So, you know, because obviously with any test you can get anomalous results. So how many times would you say is roughly an appropriate amount of tests without over testing?
I usually tell people over the course of the first 3 months is when we will likely be evaluating things, meeting more frequently, and potentially testing more frequently. So I would say within that first 3 months, we might do the baseline plus at least one other, and maybe one in between, maybe. And then depending how quickly we can get to a maintenance level, we can then space out those tests to every 3 or 6 months. But at a minimum, I would say that once someone's on maintenance, if they haven't made any changes to their protocol, they should be doing tests at least once a year.
So something I really wanted to talk to you about while I have you here today is, I guess, the whole taboo about the menopause, menstruation. Mm-hmm. Maybe start off, you could tell us a little bit about how you've sort of, your work to break down these taboos and sort of the experience that you've had over your career from what it was like when you started to what it is in 2025, where things are becoming more open. There's still work to do, but work is taking place. How have you noticed that shift?
When it comes to what the men in these women's lives can do, I think it's just to be open and aware, ask questions, be curious, and be as supportive as you possibly can, because we really don't have any clue about what this impact really is. And sometimes it's even hard for the person who's experiencing it to explain it, because we talked about the impact to cognition and the impact to just mood and the variability that occurs, right? So all of us need to have more conversations with young women about menstrual health so that they're more aware at an earlier age about what they can do to support optimal menstrual health, hormonal health, and then carry that conversation through the perimenopausal and menopausal years so that women feel supported and that they know where to access appropriate care and then what that care should look like.
What sort of tools as an education do you think are available for us these days to sort of engage more in these conversations and to have a generally more empathetic viewpoint towards women who struggle with these issues monthly?
I think that your healthcare providers are going to be a good place to start, and then online supports. Like the Menopause Society out of the US is publishing a lot of really great, not only research around menopause, perimenopause, and hormonal shifts that occur, but also around treatments. They're standardizing approaches and understanding. I would just really encourage more curious investigation and then conversations with the women in your life who do menstruate so that you can understand more what they're going through and they feel more comfortable in having that conversation and expressing from their perspective what it's been like.
When somebody comes to Alkem and asks to see you, believes perhaps they're starting the menopause phase or they're having some symptoms that are irregular and you know, you're the solution to those problems, what sort of, can you walk me through the A to Z of your sort of care plan for them, starting with the consultation, going on to perhaps testing and then, you know, etc.
At the initial consultation, which is a minimum of an hour long, it can be longer if there's a complex health history, for example, but an hour baseline. We'll go through your detailed medical history. I will, if need be, perform medical tests. And then at the end of the appointment, or towards the end, we'll talk about whether we need additional testing. If we do, what kind, when would be appropriate to test, if that's an important detail, and what it is that we're trying to understand. I try to encourage regular follow-ups with patients, and we have mechanisms at Alkem where we try to proactively reach out and ensure that patients are reminded, hey, it's time for your 3-month or 6-month appointment, let's book you in.
I think that's actually important. It's often overlooked when it comes to medical centres. It's almost like a little arm around the shoulder. It's, oh, they're reaching out to me, they're wondering how I'm doing, oh, I trust these, and you know, that's such a very small, subtle detail, but makes a huge difference, you know, one of many that Alkem has. Dr. Taal, thank you so much for joining us. It's been a pleasure to have you on the Health and Wellness podcast. Thank you so much for your time, and it's been a really insightful conversation, and I hope that our listeners also take away a lot from this, so thank you.
You're very welcome. It was a pleasure. Thank you so much. And yeah, happy to be here.
This has been the Health and Wellness podcast, a collaboration between Woman This Month and Alkem Health and Wellness Centre. Join us for the next episode.